Morning. As you know, we have arrived at joint budget targets, and so all of the budget chairs, the subcommittees chairs, have all either are meeting right now or have already met. So, as you know, once we hit the targets and people start working on budgets, at least the path becomes visible and perhaps even clearer to seeing the end of the legislative session. And I think that we still have an opportunity to finish in a timely fashion. And as you know, that's been one of my goals. So we're going to keep pursuing that. Today, I'd really like to spend a little time talking about our Medicaid oversight plan, and we talked about that for several weeks now. You wonder when it might be coming. It has arrived, and we're ready to talk about that. You know, when we think about the oversight and when we talk about that, it's really kind of the culmination of the time we've spent listening to Iowans, understanding the questions that have been raised, understanding how the plan is intended to work, and then trying to find a path to making very sure that we can keep an eye on the system and deliver exactly what Iowans are expecting here. So to that end, we have focused on kind of the House, and let me be clear, we is the House Republicans, have focused on looking at a really unprecedented amount of data, looking at unprecedented sources of data to get to the question of how we provide the appropriate oversight. So we kind of split things up, as you can see, into three different arenas. First of all, we're going to look at the consumer protection, how we're going to actually measure that and look at that. We want to make sure there's adequate amount of doctors providing care. We want to make sure that they are located in the correct places and that we have an appeals process if in fact you're not getting your first choice on health care. How do you go about dealing with that? We want to know how the call centers work. When you have questions, when you need to get those answers, how does that go? The second area we want to focus on is health improvement outcomes. So, you know, for a long time we talked about one of the really good parts of this plan is that we have an opportunity to focus more on wellness, focus on making sure that people with chronic diseases have better outcomes, that their care is more coordinated, making sure that prevention and health maintenance is addressed. And this is the place where we're really going to look closely at how we've accomplished that and what benchmarks we've achieved. And finally, we're going to look at the program integrity. And that kind of focuses a little bit on the fraud, waste, and abuse. We want to make sure we're getting our money's worth. That's we have contracts to deliver certain things. We want to make sure they're delivered and they're delivered efficiently and that we're not wasting dollars and making sure that we're providing oversight related to fraud in the system. The MCOs, whether they're adhering to their own programs of integrity, because of course they are required by CMS to have those, we want to make sure they're carrying out those plans and then looking at what the results are. But at the end of the day, what's important to know is that we have never, ever held this state's health plan to higher standards than we are today. We have never had higher standards of integrity, transparency, and accountability. All of this will be on the website. Iowans can look at it and kind of reach their conclusions just as we will.